Hello, this is Nursing 435, Week 3, Care of the Maternal and Child Dyad. Our objectives for Week 3 are to describe the physical, psychological, and developmental tasks that the new mother must accomplish during the postpartum period, compare nursing interventions for uncomplicated versus complicated postpartum period, delineate nursing responsibilities for patient-family teaching during the postpartum period, describe physiological adaptations of the newborn, assess the family's transition to parenthood, demonstrate nursing care of the newborn and family, and compare and contrast breastfeeding and formula feeding methods, including advantages and disadvantages of both. So first, let's look at the postpartum changes for the new mother. First, let's look at physical. We have the involution process, which is with the return of the body to the pre-pregnant state. Includes contractions, after pains. The placental site is the place where you get the bleeding from. And we have lochia rubra, which is red immediately for 1 to 3 days after delivery. Then it goes to serosa, which is lighter and less in volume. And then alba. The cervix will take some time to change. Will take some time to come back down to closed, and it will always be changed. The vagina and perineum will never completely return to its pre-pregnancy state. There's localized vaginal dryness because of the reduced levels of estrogen. The introitus is erythematous and edematous. So it's red and it's swollen and it's sore. The episiotomy or lacerations are usually only visible if the mother is on her side or on her back with her legs spread apart. There may be swelling there as well. Now, postpartum changes endocrine system. You have the placental hormones and pituitary hormones and ovarian function. It's rather unpredictable about when ovulation will reoccur. So mom, if she's having sexual intercourse, she should have protection against pregnancy. It's advised to wait 4 to 6 weeks before intercourse has begun to allow the placental site to heal, as well as the perineum. The abdomen, as you'll note on the the sixth slide of the PowerPoint, has a diastasis recti abdominis, where it's a separation of the abdominal muscle during pregnancy. It does take some time for that to return, and in fact it may never be the same. The urinary system, the urine components are basically the same, more fluid because of postpartum diuresis, where the mom has had an increase in fluid retention and fluid volume just by the process of pregnancy, and this is when it comes out. It's not unusual to see 2 to 3 liters in the first day or so per day. The urethra and bladder are returning to their normal positions. The gastrointestinal system, mom may have an appetite that returns, and she will need to make sure she is able to evacuate her bowels. Now, her breast, both breastfeeding and non-breastfeeding moms will have soft or filling breasts. Third day is usually the engorgement, where the milk actually comes in. The nipples should be everted, no cracks, blisters, or bleeding. And that's true for breastfeeding and non-breastfeeding moms. Now, if mom is not going to breastfeed, it's best to not stimulate the breasts at all, and even bind them in a elastic binder or a tight-fitting bra. The cardiovascular system, the blood volume returns to normal. As you remember, it increased about 50% in the second trimester because of the increase in fluid in serum. The blood components, hematocrit and hemoglobin, return to normal. WBCs also drop, and the coag factors take some time, but they do return to normal from their hypercoagulability state. Vital signs return to normal, and there may be some varicosities. That could be in the vulva, it could be in the legs, just about anywhere. Neurological symptoms. Pregnancy-induced discomforts disappear after birth. Yay! Elimination of physiologic edema is resolved through the diuresis and relieves carpal tunnel syndrome, so that the carpal nerve is not compressed anymore. Periodic numbness and tingling of the fingers is resolved, again, carpal tunnel. Headaches require careful assessment and could be caused by various things, including postpartum preeclampsia and CSF leakage from an epidural or spinal anesthesia. And it is possible to have a postpartum eclamptic seizure a couple of weeks after delivery. In the musculoskeletal system, relaxation and subsequent hypermobility of the joints resolves within 6 to 8 weeks after delivery. As you remember that the joints were hypermobile and mom kind of waddled, this is resolved with the exception of the feet. The feet, you might notice, are a little bit bigger, and they stay that way. The center of gravity returns to normal. You no longer have the bulge in the front. For the skin, excuse me, for the skin, the chloasma or the mask of pregnancy disappears. Hyperpigmentation of the areola and linea nigra may not regress completely. They may never go back to normal. You might have a little sign of that. Striae gravidarum, or stretch marks on the breasts, abdomen, hips, and thighs will fade, but they don't really disappear. Vascular abnormalities like spider angiomas, palmar erythema, and epulis generally regress in response to rapid decline in estrogen. Hair growth slows down in the postpartum period. In fact, some women actually experience some temporary hair loss. Fingernails return to their normal pre-pregnant consistency and strength. And the next slide is a picture of a chloasma, some striae gravidarum, linea nigra. Continuing with postpartum changes, the immune system. There's no significant changes in the maternal immune system during pregnancy. This is a time when you need to assess to make sure mom isn't rubella immune, or after delivery, just prior to discharge, she can be given the rubella or Tdap vaccine. Make sure that mom does not get pregnant for 3 months. Psychologically, maternal self-image, be aware of that. Adaptation to parenthood and parent-infant interactions, family structure and function. This is a time when it's common to see postpartum blues or baby blues within, up to about 2 weeks after delivery, as a result of fluid shifts, emotional shifts, sleep deprivation, and many other factors. However, postpartum depression or baby blues that last longer than 2 weeks is to be considered serious. Postpartum depression with or without psychosis. Sometimes moms have suicidal or homicidal ideations aimed at their child when they have a psychotic episode. Lack of mother-infant bonding is another concern, but be sure you take into consideration cultural factors that may be a part of the bonding process. Some cultures don't promote bonding early on, and that's for various reasons. And this is the end of part 1.